name is Nolan, and I was in a group with Sarah and Austin, and today I'll be talking to you about peptic ulcer disease. So a little public service announcement about peptic ulcer disease. It affects approximately 4.6 million people in the United States each year, and contrary to popular belief, it's not caused alone by stress. However, stress can worsen the symptoms for this, and it has the capacity to cause long-term and serious health problems if not treated, and sometimes it can take up to months to heal. And so, a peptic ulcer, it's an open sore that develops on the inside of the stomach and on the lining, or it can also occur in the small intestine. So as you can see there in the base of the stomach, that's a gastric ulcer there, or peptic. And then in the first part of the small intestine, that would be a duodenal ulcer. And sometimes they can even occur in the esophagus, which would be an esophageal ulcer. And so some risk factors for this would include smoking, alcohol, constant and untreated stress, and then eating spicy foods. And then some of the complications you would see would be internal bleeding, hole in the stomach wall, or obstruction, as the ulcers can block the passage of food and cause a lot of problems with that, and then gastric cancer, because study shows that those infected with the Helicobacter pylori, which that's a bacteria that often causes a lot of gastric ulcers, it gives you an increased risk of cancer. And so for causes for this, as stated before, the bacterium Helicobacter pylori, it's responsible for 70 to 90% of the cases of gastric ulcers and 90% of the duodenal ulcers. And another cause would be long-term use of non-steroidal anti-inflammatory drugs. So this would include ibuprofen or Advil, and steroids and anticoagulants. And with the Helicobacter pylori bacteria, it lives in the mucus lining of the stomach or the small intestine, and usually it's not problematic, but it can cause inflammation leading to an ulcer. Some symptoms that you may feel would be burning stomach pain, feeling fullness, bloating and belching, intolerance to fatty foods, heartburn, and nausea. But the thing with symptoms is many people often show no symptoms, but if you do, it's usually because of a duodenal ulcer there in the first part of the small intestine. And so for diagnosis, first part is an endoscopy, and an endoscopy is when a doctor inserts an endoscope, which is a small lighted tube with a camera. So they insert that through the throat and down into the stomach, and there they can see and look for abnormalities. And then you would have the Helicobacter pylori test, and these tests are used to determine if the bacteria is present within the body. And these tests would include breath test, blood test, stool test, or a sample that's taken during an endoscopy. And then imaging tests such as X-ray and CT scans. And the imaging tests, they're not used very often, but when used, the patient has to drink a special liquid, and that coats the digestive system so that way they can see it on the imaging screens. And for treatment, that would be medications such as antibiotics, acid blockers, and medication that protects the lining of the stomach. And with antibiotics, you need to make sure to take it for 2 weeks all the way through, even if you do begin to feel better, because taking the full dose will ensure that the bacteria or virus is killed off. So the prognosis for this, when the underlying cause is found and addressed, prognosis is excellent. Treatment typically cures peptic ulcers, and often several weeks for the ulcers to heal completely. And also it's suggested not to drink milk when you're experiencing this, because milk may momentarily soothe the pain, but it causes the stomach to produce more acid and digestive juices, which would, as a result, cause more problems. And then preventative measures, protect yourself from infections, so wash your hands frequently, eat foods that have been cooked properly, use caution with pain relievers, and make sure to take your medication with meals. Talk to your doctor to find the lowest dose of medication that still allows for pain relief, and avoid drinking alcohol and taking medication. And alcohol in general in large quantities will irritate the stomach lining, and then quit smoking as well, because smoking interferes with the mucus protective mechanisms in the stomach, making one more susceptible to ulcers. And here are my sources.